Hello, I'm Howard Williams from the Centre of Evidence-Based Dermatology at Nottingham, and I'm one of the senior authors on this summary of our systematic review of treatments of atopic eczema that has just been published in the British Journal of Dermatology. It's a bit of an unusual summary because it refers to a much larger report that's been published by the National Institute of Health Research. Now, that fuller report is in the public domain, so do delve into it for further detail if you need it. Why did we do this study? Well, doctors, nurses and patients need high-quality independent information on eczema treatments. And although there are specific systematic reviews on single treatments or groups of treatments, there's nowhere where you can find a summary of all treatments together. Back in the year 2000, we did exactly that. We summarized 254 clinical trials of eczema treatment that was published by the NIHR Health Technology Assessment Programme. That report was very popular, so it encouraged us to embark on the mammoth task of updating that review, and that's what you see a summary of in the BJD. What did we do? We did an exhaustive search of 7 electronic databases, searching the citations as well, 2 researchers abstracting the data, and then we summarize each treatment, saying what it is, what the treatment benefits and drawbacks, and then our interpretation of the data and an assessment of risk of bias. What did we find? Well, we looked at over 7,000 abstracts and we found another 287 clinical trials covering 92 different eczema treatments. So more trials published in the last 15 years than in the 50 years before that. Quality of reporting was still pretty poor, which is very disappointing. And again, although most atopic eczema is treated in the community in the UK, very few trials in primary care. Now, predictably, we found lots of evidence on the main treatment groups like topical corticosteroids or calcineurin inhibitors, proactive therapy, ultraviolet light, educational approaches, but for most interventions, including emollients, dare I say, just insufficient evidence to make any clear recommendations. But in some areas we found reasonable evidence to suggest no clinically useful benefit. For example, twice daily as opposed to once daily topical corticosteroids, or antibiotic steroid combinations for non-infected eczema, or evening primrose oil, or ion exchange water softeners. So what's this got to do with everyday practice? Well, our BJD summary really refers to a usable, fuller resource that is relevant to everyday practice. So if a patient comes into your practice asking about biofeedback, just look up the report and you'll be able to say there's no good evidence to support it. Or if you're a patient and you want to find out more information on the benefits and harms of azathioprine for severe eczema, for example, you'll find a nice summary in the report. So I hope you've enjoyed this summary of a summary, which is rather appropriate for somebody wearing a summary jacket. I do hope that you're able to bookmark the full report and make good use of it in clinic for patient benefit. Thank you.